Hi there, Clara from BMom. Today I'm here to talk about breastfeeding, how to care for your breast during breastfeeding. As you know, breastfeeding shouldn't hurt. Hear what science says about caring for your breast during this time. So, first of all, let's talk about how to keep your breast clean. Your breasts, as I say, need to be clean but not sterile. So you don't need soap each time you will wash your breast, okay? The World Health Organization recommends gentle washing once a day with warm water only, okay? Now you can use soap. You can use also you can use soap if you want. Don't use antiseptics, but if you use soap, really wash your breast like thoroughly, okay? But it's not recommended. You can just wash with water. Why? Because you will protect the natural skin oils and keep your nipples healthy. So to support healing naturally, so I know that sometimes we are at home, we have some visits, especially at the beginning, and we have, our nipple are often like wet. Now we have new devices that allow us to be more dry. But when you are at home, it's a good habit to keep your breast, air drying, okay? Because first of all, it will feel comfortable for you, and plus they will be dry. And something that you can do also after breastfeeding, it's to express a little drop of milk and to rub on your nipples, because milk has has healing properties. They contain like antibacterial. It's really good. It's help with like healing, and just to rub that little drop and leave your your breast to be dry, hair drying. It will help your nipples not to crack or not to be sore, okay? Don't use any cream with alcohol based, okay? That's not good for breastfeeding. Something that you will need to avoid also is engorgement. Okay, so that means that sometimes your baby can sleep like a little longer, and now when it's time for you to breastfeed your baby, he's sleeping, you don't want to wake him up. Don't forget, don't let your baby sleep more than 6 hours, okay? So but now you will also have that, an engorgement. And to prevent that, you need to, of course, feed your baby frequently, ensure that your baby has a good latch. And if that happens and your baby is sleeping, maybe you will want to gently massage toward the nipple, or do what we call express. And you can use, warm cloves and cold cloves and put on your breast, just to make them like a little tender, especially the warm one. And when not tender but softer, sorry, and when it's softer, you will be able to express some milk out, okay? This is one thing that you can do. Now, when you need to get help, let's say you have some pain, your breast is red, and you have a fever, and you are very engorged, but there's nothing coming out, or if something is coming out, you will have like some blood, or you will have some, some pus coming out of your breast. That means that you have an infection. That means that something is wrong. So this is when you will reach out to your midwife or to your lactation consultant, making sure that this is taken care of, okay? So, and don't forget, your breasts are doing powerful work. Gentle, simple care keeps you comfortable and keeps your breastfeeding going strong. I hope that my tips help you, and follow my page. Go on my website. As you know, I have some packages to prep you for for birth, labor and birth, but also on nutrition, and also to support your partner. Otherwise, you can find some information on the breastfeeding, on the World Health Organization, not only, but La Leche League. This is also a good resource for you. And those are where sometimes I go and look at what's going on in the world of breastfeeding. Thank you so much.